This meeting is being recorded.
Good evening, ladies and gentlemen. Thank you so much for joining us this evening. My name is Gary Makakula, and I'm the Key Accounts Specialist for Bestmed. Today, we're going to focus on our Beat2 as well as Beat2 network option. We have made these information sessions to be available to our members throughout the week. So we've started the sessions on Tuesday, and we are continuing per option to unpack and make you understand how your option works. Thank you so much for RSVPing and joining us today. With me is a panel of specialists in each department that will be assisting us in our Q&As as well as chat functionalities to any questions that would arise. And we will also take questions at the end of the session. The agenda for today, we'll look into the hospital benefit for Beat2, PMPs as well as DSPU networks, chronic medication, maternity benefits, preventative care benefits, our Tempo 2023, savings and contributions, Savers channel, our Bestmed app, as well as we will take questions then after this session. Beat2 option is basically our hospital cover with at least 16% of the members' premium that forms part of their savings account. So it has a full contribution, it has a full benefit rather with regards to savings. So 100% of schemes tariff with no overall day-to-day limits. For Beat2, members can make use of any private hospital. For Beat2 network, there is a network hospital list through our Mediclinic, Life, as well as our network list. It is important that you know that for mental health clinic, we do have limit for up to 21 days. Treatment for chemical and substance abuse is up to 21 days to a rand value of 35,000 or 15 contact sessions with outpatient psychotherapy per session. Major maxillofacial surgery covered as PMB. Internal prosthesis for spinal, including artificial disc for single level based, which was previously excluded on this benefit. Continuation on hospitalization for Beat2 as well as Beat2 network. Functional prosthesis limited to up to 31 days. Palliative care as well as home-based care up to 63,420 per beneficiary per year. Biological medication during hospitalization, pre-authorization is required and to a limit of 15,855 per year. Specified co-payments for voluntary of non-use network hospitals. So for Beat2, if you make use voluntarily of a non-network hospital, there is a co-payment of 13,078 rand. There are exclusions on this option, which is for joint replacement, except for a case of an emergency. Dental and oral surgery covered at 100%, subjected to savings. Day procedure at day hospital will be funded at 100%. Voluntarily use of non-DSP, there will be a co-payment of 2,500 rand. Then our Beat2 network, there are restrictions for the network hospitals with the link there once we share the presentation. In case of an emergency, the member can be admitted at any hospital, but as soon as the patient is stabilized, they will then be transferred to their network hospital. If you choose to make use of a non-network hospital voluntarily, there will be a co-payment of 13,078 rand. Out of hospital benefit on this cover, like I did mention, 16% of the members' premium forms part of their savings account, which will be utilized for their out-of-hospital benefits. The savings are available up front for a day-to-day benefit, for such as doctors, acute medication, and etc. Unused savings account are carried over for the year, so you don't lose out your savings account for the current financial service. Once these services are finished, any further accounts will be paid from your pocket. What we pay from the scheme outside of your savings will be the diabetes primary care consultations, which we pay 2 of those consultations at any discount at 100% of scheme's tariff. We also pay for scans for specialized diagnosis like MRI as well as CT, up to 5,885 per year at 100% scheme's tariff. Wound care benefits, we will be paying for that up to a rand value of 3,885 per family per financial year. Hospitalization authorization, it is very important to take note of these numbers. 0800 220 which is for our pre-auth department, and provide them with the most important information, which is your membership number, dependent code of patient, treating doctor's practice number, hospital practice number, date of admission, as well as the ICD-10 codes. Rehab service after trauma is payable as PMB to only designated service provider, which is applicable. Benefits for medication. We've got cover for chronic, which is the 27 chronic disease list, plus 18 prescribed minimum benefit conditions that are required by law to be covered by the medical aid. These are the 27 chronic disease lists that we cover on Beat2 as well as Beat2 network, together with the 18 prescribed minimum benefit conditions that we cover. For non-formulary medication, there is a 30% co-payment. So it is important that if the member completes an application form with their treating doctor, they need to have a chronic list to avoid co-payments, because then once they choose medication that is outside of the formulary, there is a 30% co-payment. The process to get authorization for chronic medication, the patient will and their treating doctor will be required to complete an application form. And once that is done, you can be able to send it through to our email at medicine@bestmed.co.za. If a new member was registered on chronic with their previous scheme, they may need to submit a chronic letter along with a copy of their latest prescription. Processes to get authorization for chronic medication. For Beat2 network members, you will need to utilize the network pharmacies, which is Dis-Chem, Clicks, Van Heerden, MediRite, Pick n Pay, as well as MediPost. Prescribed minimum benefit medication. They are set to a minimum benefit, which by law must be provided to all medical scheme members. That includes provision of diagnosis, treatment, as well as cost of ongoing care. Registration from PMB, you need to download the PMB registration form on our website or speak to your key account consultant. Submit that to pmb@bestmed.co.za, and it is important to make use of the designated service provider. What is required to register medication on chronic? For first-time applicants on Beat2 as well as Beat2 network, you need to complete an application form with the supporting information. For new medication to be added for an existing authorization, so if you are previously being registered already, you just need to update your medication. We do need a copy of your prescription with supporting information, and these must be sent to medicine@bestmed.co.za. And we also do have a telephonic authorization where the doctor can speak directly with one of our pharmacists. Medication on acute. Prescribed medication for conditions that are not listed as CDL or PMB will be paid from the available savings account. Over-the-counter medication will be funded from the available savings account, and these will be paid at 100% of scheme's tariff. Formulary and co-payments. All the formulary listed for conditions diagnosed are available on our website, www.bestmed.co.za, which will be for the CDL conditions, the chronic disease list, plus prescribed minimum benefit conditions. For items that are on the formulary, there is no co-payment. And if your doctor prescribes a medication that is not listed on the formulary, on Beat2 and Beat2 network, there will be a 30% co-payment applicable for that specific medication. Please note that those formulary medications are not automatically approved, so pre-authorization is still necessary to gain from our medicine department. Advanced medicine supply. In cases where you need to be outside of the borders of the country on this particular option, there are reimbursement conditions. If a member is going on a designation across the local borders, if a member is going overseas, or if a member is going to a destination where there is no pharmacy in a nearby vicinity, for an example, like a Kruger National Park, you need to complete the relevant application form, return it to Bestmed at least within 2 weeks prior, attach a copy of the flight ticket or travel document, attach a copy of the prescription for the medication required, submit those to medicine@bestmed.co.za, or they can be faxed to 012-472-6760 to be able to get advanced medication. Maternity cover on Beat2 and Beat2 network. We've got 100% schemes tariff benefits, which we pay for 6 antenatal consultations with either a family practitioner, gynecologist, or as well as a midwife. We do have cover for ultrasound scan, which we pay for the first trimester, as well as for the second trimester, with either your family practitioner, your gynecologist, or radiologist. Our preventative care benefits. These benefits are paid by the scheme, does not affect the member's medical savings account. So on this particular option, which is Beat2, we have a full cover for hospitalization covered at 100%. You then have 16% of your premium forms part of your savings account, which you utilize for your day-to-day, or rather out of hospital benefit. Then you've got your preventative care benefit, which does not affect your savings account. We as the medical scheme pay for them. That includes the flu vaccine. Sorry, let me just go back. It includes the flu vaccine, travel vaccine, pneumonia vaccine, pediatric immunization, baby growth assessment, which we pay for 3, female contraceptives to a rand value of 2,550 per beneficiary per year, back and neck preventative program, pap smear for females 18 and above every 24 months, HPV vaccine for 3 vaccination per female between the ages of 9 to 26, preventative dentistry, mammograms for females over 40 and above, as well as PA screening for males 50 and above every 24 months. So out of the 14 preventative care benefits, on Beat2, we pay straight up to 12 of these. That exclude the Mirena device, which you don't cover on this particular option, as well as the bone densitometry. So the rest of the 12 preventative care benefits does not affect the member's medical savings account. We as Bestmed pay for them. Our tempo offering for 2023 includes the Get Fit Fitness Journey, Nutrition Journey, Health Journey, Emotional Wellbeing Journey, as well as our preventative care benefits. For step 1, it's important that you do need to make use of a health assessment. Either you go to a network pharmacy, or we will be on site at your employer groups to be able to do the health assessments, and results will be shared to you via email. Step number 2 will be for you to either select your journey, whether you do a Get Fit fitness journey, which is one fitness partner through a Biokinetics. It's either can be via face-to-face, and we have a follow-up, which can be also face-to-face or virtual. Or you can select a nutrition health journey, which qualifies for one nutrition assessment test with a follow-up with either in-person or can be virtual. And also an emotional well-being journey, which has been developed rather by our qualified psychologist, and it's aiming to assist and with identifying managing of emotions. So these will also be available through our member portal, which you'll be able to see the results. Where to find the tempo providers: www.bestmed.co.za. Under the menu, choose Tempo Wellness Program, and you can just search for the provider with the area that is closer to you, and you can be able to see which is the closest provider for you. Savings and contributions on Beat2 as well as Beat2 network. 16% of your monthly payable contribution forms part of a savings account. There is interest-free loan. All expenses that are not covered as scheme benefit are payable from the savings account. The money in the savings account can only be spent on you and your family expenses. Unutilized amount in your annual savings account are carried over to the following year, so you don't lose your savings account. It is the member's property, so it is important to note that if you resign from Bestmed, your savings account are transferable to your new medical scheme, provided that they've got the savings account. If not, then that money will be paid into your account after 4 months of your resignation, because we will have to wait for 4 months to declare all claims. If there are no claims received, then that money will be paid into your bank account. We pay 100% of scheme's tariff, and claims must be received from a registered healthcare practitioners. Savings account calculated on Beat2. If it's a single member only, per year in advance, you will receive 4,452. If it's 2 adults and 2 children, it will be 11,688. And if it's member plus a spouse only on Beat2 will be 7,920. And obviously there will be lesser savings on Beat2 network because it is a cheaper option. So principal member only will be 4,008 rand. 2 adults and 2 children will be 10,488. Member plus a spouse will be 7,128. The contributions on the left-hand side is our network Beat2 option, which is an EDO option, efficiency discount option, which is 10% cheaper than the non-network option. The only difference mainly would be the fact that there is a network of hospitals that you need to attend to, which you then, if you are closer to those hospitals, as according to our list, you are able to have a discounted option, which is why that network option was created. And our non-network option, which then principal member will pay 2,323, adult dependent 1,804, child dependent 978 per child. And in the non-network option, you can be able to be at any hospital of your choice. Contributions with Bestmed, you pay up to 3 children. The rest will be covered for free, provided that they are under the age of 24. Child dependent are covered up until the age of 24. And if your child is still at school, then and registered, they will be covered as child dependent up until the age of 26. It is important that you update the medical scheme when your child turns 25 and 26. Per year, you need to send us a letter from school to confirm that the child is still at school, so that the rates for the child can still remain as a child dependent. Service delivery contacts. These are the contact numbers for services, for call center, email, WhatsApp, fax, website, Twitter, Instagram, as well as Facebook. Our operating hours is from 8 to 5 on weekdays and 8 to 3 on Saturdays. If you make use of any smartphones, which it's either an Android or an iPhone, please download the very helpful Bestmed app. Visit your app store, search for Bestmed, and download the app and register to log on to the details. This is a user-friendly app that you make use of. To avoid you to actually now call into the call center to either maybe check your balances or submit your claims, it's user-friendly. I'll take you through the steps. These are the main menus, which has all the functionalities onto it. Once you've registered on the app, you'll be able to view any communication that is sent to you directly. You'll be able to view and share your membership card. So in case where you don't have a card, you are able to share these with the practitioners, whether a doctor or pharmacy. You can email it directly to them from your app. Benefits on savings, information that you'll be regarding to view on your savings balance, as well as authorization of claims. Self-service items that includes provider search, submitting claims, requesting new membership cards, important documents, as well as updating new services. Network service provider, so you can be able to also search for a provider on the network. When you click on the network provider search and search for the area that you're at, conveniently so, you are able to submit a claim or documents to the medical scheme. So you just need to take a photo of the claim and press submit, and it will come through to our contact center. There are contact details should you need for our call center. Service at Bestmed or any other pre-authorization contact numbers are available there. Your wellness journey, you'll be able to see your journey, as well as your profile, where you can be able to update your profile with any changes, whether contact number or addresses, to avoid you calling the contact center. Ladies and gentlemen, that is the end of the session on the Beat2 as well as Beat2 network. I did say that we do have a panel of specialists that are with me today. If there are any questions, I'd appreciate if you can ask.
Good evening, everyone. My
evening.
question is based on authorizations. I've got a procedure that I'm supposed to go to tomorrow, and I gave the codes to the consultant that I was speaking to, and the doctor did make recommendation as well. And one of those laparoscope and some others were not, they said, I got an email that they won't be paid. So I don't understand how, because the doctor saw the need for him to perform that procedure. How are we going to do that one?
And the procedure is tomorrow.
Yes.
Can I probably have one of the experts to take down your membership number to look into it?
Okay.
I don't know how we're going to share this. Can one of the experts please share their email address so that the member can be able to send through?
I can even give my member number here. I don't mind. It's just a member number. Then they will have my phone number and my details there. It's 197.
Okay, 197. Someone can say please.
581.
581.
432.
432. Can you just repeat it for the last time?
197 581 432.
I will ask one of the specialists to look into it and provide you with feedback. Thank you, Bomgazi.
Thank you, sir.
Any other questions? Yes, Pumla?
Hello, team. I have typed the question, but I will have to rephrase again. I'm concerned about the little amount that we contribute towards the savings, having a list of all the benefits that are dependent on those savings. They get depleted around about March in the beginning of the year, and then a person just can't even visit a GP because the savings are depleted. Is there a way that when we choose these options, then there can be an option where we can increase the contribution per member so that we are not all blanket at a certain amount? If I want to contribute more so that I can have more on my savings, then at least I can have that option. Thank you.
Thank you so much, Pumla, for your question. We have made these options to be also cost effective for our members. And I just understand the way you're phrasing the question, it's probably a concern that you need to review into upgrading to a higher option, which could be then our Beat3 that has got more benefits into out of hospital, because 16% already of the premiums that you're paying on Beat2 form part of your savings account, which your hospitalization is mainly covered for, and the little that you have on that 16% is for your day-to-day. And if you feel that that day-to-day is not enough because you are either using more of those benefits, then considering to move to our Beat3 option would be advisable.
Thank you so much. I will do so.
Thank you, Pumla. Any other questions? Yes, Noxolo. Noxolo, you can unmute.
Can you hear me now?
Yes, I can hear you now. Thank you.
All right. The savings, as well as the sister has said, they are really very small. But then, as you are saying, one must upgrade. I wanted better savings, but Beat3 for me was a bit costly, but it's fine. The day I get a better offer, then I will surely upgrade. The other thing, your specialist visit, Why are we guys taking from the savings? Because it's already small, you know, and the dental also it takes from the savings. So if I go and extract the tooth, so my savings are gone. So can you find a way of making these benefits come from somewhere, not from our savings, the specialist visits and the dental?
I think, as I also previously answered the previous question, is that the option itself being, all rather options are submitted to the Council of Medical Schemes, and these are the approved options based on how we are rating them from pricing to benefit structure. So the importance is that once as a member, you get to a stage where you feel that your benefits are exhausting rather earlier than what it's supposed to be, then it will be then an opportunity for you to look into upgrading into the higher option. Rent for rent, if you look at it, if your benefits exhaust around April, May, and then you end up paying for your benefits additionally from your own pockets, just calculate how much you are actually spending from your own pocket then after for the rest of the year versus you having to upgrade to a better option that will give you maybe more benefits for your out of hospital. Thank you.
Thanks.
Next question. Nobukose?
Hi, Gary. Thanks. So, like, I'm new to this whole medical aid thing, and
Welcome.
I think I just had questions to say. The first question is, who do I contact when I need help? Because when, you know, the consultant initially like explained all the options, I told him that like my general needs above everything else is dental, you know, what would be the best option for single, no kids, living with myself? And he said, this is the best option for me. But I find that now I have to co-pay for everything I'm doing. My savings are finished because obviously dental visits. And every time I phone to ask for assistance or guidance, I can never get, like, I feel like I'm not getting feedback. So I'm a bit frustrated. So mine is like, who can I contact or who can be like a help buddy for using the medical aid properly? 1. 2, at work, we had, I think one of your representative people who came and, you know, when they do like that whole, do you have any questions? And then they give you a few freebies. And then he promised that he would come back the following week to sort of show me anyway, how I can claim the wellness benefit, or I don't know if you call it the preventative benefits of the medical aid. And I've been waiting since. I've tried to contact, I'm just like, I'm not getting feedback. So it's again on the communication. And then please explain to me if let's say during a consultation, like consultation before you choose an option for the medical aid, let's say somebody says, no, you'll be covered on the network. And then you use the doctor, right? And then you get co-payment. Like I don't understand the co-payment thing because I'm paying for medical aid. And
which employer group do you belong to? Which employer?
I'm with Nelson Mandela.
Okay, so I will be able, just need to write it down. I just want to take your details so that I can get the designated key account for your group to contact you. And then you are able to have their direct access, either an email address or contact number.
Yeah, it would be appreciated.
Yes. If you don't mind, please, you can share either your membership number.
Membership number, just give me a moment. Let me just search my email.
You said the employer is Nelson Mandela?
Yes.
Okay.
Can I type the membership number on the chat?
Yeah, you can.
Okay, I'll do so. I'm just looking for it.
Okay, thank you.
Thank you.
Nyami.
Okay, thank
Yeah.
you. Hi, I just want to find out, is there anything that you guys cover with regards to eye care? Like something that, in fact, is there anything that you cover that does not come out from my savings?
On Beat2, we
On
have
Beat2,
cover for
yes.
for preventative care benefits. We pay for them. And then out of hospital benefits are payable from your 16% savings account. Then hospitalization, we pay for in full as well, 100% at any hospital of your choice if you are on a non-network option. So also this option that you have selected, it's got minimal savings accounts that are utilized for out of hospital benefits. Over and above that, we still have cover for preventative care, preventative care, which we pay for as a benefit.
Okay,
Yes.
thank you.
Thank you.
No,
Basetana?
Good evening, and thank you for providing this platform for us to ask our questions. I just wanted to just get clarity on pre-authorizations. You know, the timeline, in the sense that if I have an appointment with a doctor, do I first have to do the pre-authorization, or after my appointment with the doctor contact you? You know, I just want to just get clarity on that whole process.
For what?
Thanks.
For out of hospital or for in hospital?
For out of hospital.
Okay.
So
very important.
Just like,
Sorry. Very important. With out of hospital, you make use of doctors of your choice. So also, if you need to go to a specialist, you're more than welcome to go directly without you having to get a referral. So with regards to authorization, you make use of any doctors of your choice. We do, however, have what we call a designated service provider list, which is contracted service providers that have ensured that they will not charge any additional amounts as according to the tariff. So we pay them 100%. So if you would like to have those, they are available on our website. We'll be able to share them to you. But other than that, you make use of any doctors of your choice without any pre-authorization. That is for out of hospital.
Okay, thank you. So for example, with the back and neck, you know, offering that you guys have, I can just go to any doctor and then.
So that is for the preventive. So that is for the preventative, right?
Correct.
Can any of the experts please help me with that question? Can any of the experts please help me with that question?
Gary, can you repeat the question?
With regards to the back and neck, is pre-authorization required, or they can just go straight?
I think you still need to inform us. You can't just go straight, because back and neck rehabilitation program is not for everyone. Not everyone is eligible for it. It's for certain cases where a member is about to, you know, maybe doctors are recommending that they have a back operation and we feel like the situation can still be salvaged. So it's for certain situation, it's not for everyone. So we recommend that the member leaves her details, and then we'll be in the position then to direct them to the right channels. Because like I said, it's not for everyone. It doesn't mean you've got a bag and then you just go and then no, it's not for such, it was not designed for such instances. So if you don't mind, just leave your email address on the chat and then we'll contact you regarding that.
Okay, thank you.
Okay.
Thank you, Masitana. Thank you, Refila. Pamela?
Thank you, Gary. I've just checked on the chats. My 2 questions haven't been answered, so I will have to then voice raise them. One is about family planning. My daughter is taking injection, but now at Clicks and also at the GP, they need me to pay cash. So I have to pay cash time and now. When I inquire, then they tell me that they cannot claim directly for family planning. I should be the one submitting receipts to Bestmed. Is it that so? Do I have to do it that way?
For service,
And the second
for-
one, let me also phrase the second one.
No,
The
sorry.
second one is about the ambulance. The ER24, is it only for accidental emergency or any emergency? Because I have a bill since 2020 for my son who we suspected he had COVID. So we had to call an ambulance. But then after a year, ER24 said Bestmed did not pay, so I have to foot the bill. Please assist me with those 2 questions, family planning and the ambulance assistance.
Okay, for family planning, where service providers are unable to claim, you as a member, if you do pay cash, we will be able to reimburse directly to you from our preventative benefit for your daughter. And with regards to the 2020 ER24 claim, I mean, it was during the COVID time, so it is important that we can just be able to assess through what actually happened in regards to that procedure or incident to be able to give further advice. So your email address, let me just check on the chat functionality.
Since I also need information on Beat3, I have just written my email address on chats because I can see people are requesting. I thought we can also have access to it on the app where we can just shift from Beat2 and to Beat3. However, my email address is there. It's oyenamatu@yahoo.com.
Gary, I'd like to elaborate on the ER24 matter. So the ambulance services, it's for an emergency. And it is just so unfortunate that as a member, you regard a certain situation with your child as an emergency, only to find when the ambulance comes, it's really not regarded or classified as an emergency. If I may maybe give the worst case scenario, we're talking more of a life-threatening situation. So in the event where if someone does not get help in the next hour, chances are they might lose their life. So once we start thinking like that as members, we'll be in a position where we would say, we don't use the ER24 services as transport to get, I know maybe that sounds horrible, transport from my home to the hospital. That's not what an ambulance is. So irrespective of whether you called it or not, yes, they will treat your child or take them to the hospital. But at the end of the day, we need to be wary of the fact that it is of more for an emergency, which is like critical situations, instead of minor ailments that probably, you know, you could have most probably just drove or took the child through to that. So it is a thin line, I know. You will only find this out once the ambulance has come. But me talking about this is more of a, you need to know that it's more for serious ailments, life-threatening kind of situation. I hope that clarifies the confusion. But we can still look into the child, the case from a year ago, and then let's see as to whether if there's something that was missed from that case. I'm not dismissing it completely.
Thank you, Refilwe. Thank you, Pumla.
Thank you, Kerry. I will just now know that the ambulance is only for accidents because I was really scared. I thought he was dying of that COVID. But anyway, Refilwe explained it clearly. It's up to a member to decide if this is a 1 minute dying case or not. Thank you so much, Kerry.
Thank you so much, Pumla. Jason?
Hi, I just wanted to ask in terms of what's been, like what I was interested in is what's changed in terms of what's been cut from the Beat2 plan. versus the 2022 plan.
Mhm.
So I don't know if you didn't really highlight that as much. Can you go into some of the biggies?
What we cut.
Or shrank, yeah.
We have a 5.7 increase in terms of benefits on an overall, 8.9 premium increase for 2023, and as closely as we could, we just kept the same benefits as we offered mostly for our Beat2 specifically. There would have been changes on the Beat3, which had some few reduction simply because we needed to have a merge and a simplicity from an option of Beat2 to Beat3 with an easy upgrade, because we just felt that our Beat3 was slightly bit higher on the market versus to what was offered. So mainly on our Beat3, we just had the contribution increase as well as the benefit increases. So benefits still will look the same.
Okay, thank you.
Thank you, Jason. Any other question, ladies and gentlemen? Catherine? You may unmute. Just struggling to
Hi,
hear
can you
you.
hear me?
Yes, we can hear you now.
Yeah, good evening, everyone. Thank you for the presentation. I have one question. Some time ago, I checked the network specialist and chose a gynecologist from that list. And then that gynecologist recommended another gynecologist for the specific problem that I was solving. And then after some time, I had to still come back to the gynecologist I first chose because the other one is out of network. So it was very expensive continuing with that person. And then but I also needed to check with this other gynecologist that I first chose from the network because it was an issue that I could check with him instead of going to the other more expensive specialist. Only for me to find out that is like he has been removed from the list of Bestmed's network of gynecologists. So now I was now faced with the issue of paying for the visit because it was now out of network. So I'm not sure if, I don't know if Bestmed would inform us because, you know, with these doctors, they're not people you can just change like your clothes because you built a relationship, they know your cases, they've been treating you, you're still on the matter that that took you to them, you can't just switch. So at what point do we get a feel that Bestmed actually cares for how the people that we are relating with in terms of caring for our health and taking off people from the network and then informing also us and giving us time to at least maybe look for alternatives or adjust or at least make a decision to say, okay, I would pay and not just finding out when you go to the doctor's consultation room.
Thank you so much for that question. With regards to that specific question, we have a separate department that deals with that, which is our service provider department, that their functionality is to at least get doctors and specialists to be on our provider list to ensure that our members don't pay an arm and a leg onto their medical aid. What is the most challenging part that we've received is that it's up to the doctor's discretion to either belong into that network list, and doctors at times vary and they will change and cancel those contracts from time to time. And we do urge members that if you can, please assist us to at least give us your provider's details so that we can be able to invite them on the network. It is very important to understand that we are trying from our level best of discrepancy to have these doctors registered on our list so that our members can enjoy similar benefits and not pay high rates. But at the end of the day, with the limited resources in the country with regards to specialists, it is then up to the doctor's discretion to actually know whether they will belong into our network list or not. And at that time, those lists do change from time to time. So with your current specific doctor, please, if you can, get us their contact details, let our department to contact them and invite them on the network list.
Thank you.
Thank you, Catherine. And more?
Gary, if I might answer on Catherine's question about the specialist.
Was it sent on our Q&A or chat?
No, it was the one about the specialist that went off the network. It's Ria from Provider Relations.
Okay, sorry.
Yes, Catherine, good evening. And I do want to apologize. Unfortunately, the doctors are allowed to, or they do cancel their contracts from time to time. What we try to do is, as soon as a provider cancels his contracts, we send out correspondence to all the members that was treated by the specific provider within the last 6 months to inform them that the provider has cancelled his contract and that is no longer part of the Bestmed specialist provider network. What I would suggest that you do is to contact us directly at specialists@bestmed.co.za so that we can look into the case and maybe negotiate on your behalf with the provider to see if he is not maybe going to lower his rate for the time that he treated you for this specific problem.
Thank you very much. This happened like a couple of months ago, so I'm not seeing the doctor anymore. So yeah, I just wanted to find out how that works, and thank you for the explanation.
Thank you so much, Catherine. Ria, thank you so much for coming in and explaining it further. I truly appreciate it. Any other questions? Thank you, Elsie. You may unmute. We can't hear you on our side.
Are you speaking to me?
Yes, you can ask your question.
Okay, thank you. Sorry about this. I just want to ask, I've got a partner who came from Germany. He's a South African, but he was in Germany for a lot of years, and he belonged to a medical there. And I did inquire people who were on medical from outside of South Africa. South African medical aids what I can say, they don't accept that. And he's now 55 years old. So after 35, it's 20 years that he hasn't belonged to a medical aid. What is the late joining penalty? Is it double payment of the penalty of the payment for a specific option? Or is it 1.5, 175.75?
175, yes, it's up to 175, basically makes up to 75% of late joining penalty.
Okay, okay, yes. Thank you very much.
Thank you.
Thank you.
Crazy.
Good evening, everyone. I just need a little bit of clarity, Gary. Thank you anyway for the opportunity now. On the matter of the hospitalization benefit. I'm on a Beat2 network, so I just need a little bit of clarity with 2 points there.
Okay.
So when you say, is it okay if I say the the hospitalization benefit covers 100%
yes,
of the member being admitted at the hospital?
Yes, but remember, it's through a network hospital because you're on a Beat2 network hospital plan.
Yes, on an approved network.
Yes.
So does that mean the services that the network provider is providing, are they also, I mean, what I'm asking this, Kerry, because I have an issue that I don't want to understand. In fact, I do not understand, man. I would like to understand it. Where a member has been admitted in a network hospital, but
with
now
pre-authorization
with
confirmed.
pre-authorization confirmed.
Okay.
Yes. So I'm not sure if I can. Who can I talk to with regards to such a case?
Okay, you can send your membership number also on the chat functionality, and then I'll have one of our specialists to contact you.
Thank you, Gary.
Thank you.
Sure.
Mohale? Mohale, you may unmute. Zamakanya?
Good evening, guys. How are you?
Hello, Zama.
Yes, I would like to just find out. My daughter has been, when we went to the dentist, they recommended that she needs braces. So I'm not sure, because my network has been on and off, if that was covered. That does Beat2 cover that, or does that come out of the savings option?
It is payable from the savings.
From the savings, okay.
It's payable from the savings, yes.
All right. Thank you.
Is there any other last questions that we can take? Nasima, this will be probably the last question that we can take, and the rest we can be able to answer from the chat functionality.
Hi there. I just want to see, is there a waiting period if you join Bestmed from another medical aid?
We will be able to review into that with the if there are any existing conditions, but it's not a definite for me to say we don't have any waiting period imposed up until the application form is received, because we'll be looking into your existing conditions and also the timing on when you would actually join the medical aid. So for now, for next year early, all application forms received will be reviewed onto whether there will be any waiting period imposed, depending on the conditions existing.
Thank you.
Once you complete the application form, we'll be able to give you feedback if there are any imposement of waiting periods. Then you can sign up on those if you have agreed on them, and then your medical aid will be able to be activated. Any other questions? Yes, Beauty.
Hi, Gary. Thank you
Yes,
for this
Beauty.
platform. Mine is not even a question, but I would like you guys and the panel to please improve on the call center agent. Sure. The service we are getting there, when you need maybe pre-authorization or you need help, you would feel that you're not even on a medical aid. It's like they're doing you a favor. And remember, it's not like you would call them maybe twice in a month. These things happen after a while, but the experience is very bad.
Firstly, I would like to apologize on their behalf. If I may ask you, is it from an employer group or your individual member?
Individual member.
Okay, because I know that the workload on our call center from time to time, it does overwhelm us, and we do try our level best to actually speed up the service experience there. And I would like to truly apologize on their behalf on all the inconvenience that you've experienced.
No, thank you, Gary. But then I think going forward, there should be improvement there.
Yes, the managers on the department are also actually listening to this message right now.
Thank you.
Thank you. Pumla?
Thank you, Gary. Actually, this question is raised by the question that was asked by Ukwezi. Some of the procedures when you are in hospital, like radiography and the laboratory, they are not paid within the hospital benefit. Then while you are released from the hospital, then you have bills that you have to pay. For instance, Lancet Laboratories, I have a huge bill of plus minus 9,000. And when I look at the benefits for Beat2, yes, they are to be paid from my savings, which is then depleted. So when you are admitted in hospital, doesn't Bestmed Beat2 pay for everything that happens within the hospital? Thank you.
We pay according to the authorized procedure up to 100% of scheme's tariff. But also just to emphasize, other hospital and treating doctors in hospital are then charging over and above the 100%. Then that is why there are insurances like your gap cover, which are there to actually pay what the medical aid difference would be with what the doctors have charged in hospital. So members can also opt to look into a gap cover option where you pay probably around 150, 180 Rand per month, which will pay for those bills. That's the difference between what the specialist or treating doctor has charged in hospital while you still had a authorization and what the medical aid has paid as confirmed to as the 100% medical tariff.
Thank you, Gary. It makes sense. I really was also not sure what's going on. Now it's so clear, it makes sense. That means they went beyond what the option pays for. Thank you so much.
Thank you so much, Pumla. Ladies and gentlemen, if possible, can I please then adjourn the meeting? We do have this session available on record, which will be shared to you via email. Once again, thank you so much for joining us this evening. It was a big session with a lot of informative questions that were asked. Thank you so much from our side and from our team for joining us through, and good evening.